What does it mean to contract a zoonotic disease? Merriam-Webster Dictionary and Robert Preston offer the definition as a virus that lives naturally in an animal and can infect human cells, perhaps mutating slightly in the course of passage, which enables the virus to start a chain of infection through human hosts. So far, for the sake of this conversation, I'll start by saying that the HIV virus originated as the SIV virus in monkeys. This is where HIV began, dating as far back as 1920. This includes a possible deviation to give or take about 50 years. But how did it get from animals, very generally speaking, from monkeys to man, and how did this spread? So one of the first stories was that it could have been from human hunting an animal and contracted it through a cut or something as such. Others are related to the study of animals and contracting HIV through bodily fluids and cuts, etc. But why wasn't it looked into when humans began suffering? Sadly, when something is looked upon as being contracted from sexual activity, drug use, some ignore the causes and possibly even as a population control mechanism until there's a major problem or a major accidental breakthrough. People don't pay enough attention, and there isn't enough scientific evidence for things to gain financial support for research. The HIV virus is the cause of AIDS, but AIDS is a disease, and HIV is the virus that causes it. So when you catch AIDS, it's not that you caught a disease, it's that the virus caused the disease. So, for example, the very first HIV virus was in monkeys. Then it was spread to humans. Then, after it was spread to humans, the virus started affecting the human immune system, and that is what caused AIDS. So let's take a look at the HIV timeline. Clear back in the 1960s, AIDS was prevalent in Africa, Haiti, and then came to the U.S. The first U.S. published reports weren't until 1981, and the reason that they were ignored was because they were reported in people that were gay or people that were women involved in drug use or engaged in sexual activity, and the children that were born by those women. So because the U.S. media and the scientific communities ignored it because they said that these people weren't really socially acceptable and those people didn't really matter as far as getting things under control. The first legislation to allocate for AIDS died in the committee in 1982, an entire year later. Think of how this relates with the COVID virus and how quickly things started getting under control with the COVID. So in 1983, they finally dedicated funding for the first approved AIDS research. Then a New York City physician was even threatened from his eviction in his office building because of even treating people with AIDS. The U.S. Food and Drug Administration licensed the first commercial blood test to detect HIV 3 years later. Then in 1986, there was a report that was telling the insurance companies that they were losing about $50 billion a year by 2000 if they didn't get this under control. The number of reported AIDS cases in the United States reached 100,000 in 1989. So by 1994, AIDS became the leading cause of death for all Americans aged 25 to 44. That was a major epidemic. The U.S. Food and Drug Administration finally, in 1996, approved the first HIV home testing kit and the first HIV urine test. In 2023, an NIH, which is National Institute of Health, supported trial for a preventative HIV vaccine. That was over 25 years later after the first documented in the United States. In 2023, NIH supported an HIV vaccine. That was well over 25 years after HIV has killed over 700,000 people, and it's estimated that 30 million adults and children worldwide are treated each day, and 16,000 newly people are infected with the virus every day. Now at present, after we have finally come up with an HIV vaccine to be tested, and there are people that are using it, now we've come up with the resistance that's emerging as the area of grave concern within the AIDS community. And now we need to start looking at the possibilities of a different vaccine so that we can combat the new strains that are coming out because of the virus becoming immune to the vaccines we finally came up with after 25 years. It is extremely important to pay attention and make sure that we are educated when it comes to viruses, whether we think that we are related to them or not. One of the best sources of information I found is at the Mayo Clinic when they're talking about the saliva and blood tests and how things can be contracted and spread. We need to really be paying attention to everything we do every day to make sure that we don't contract these germs and that we don't spread them to others.